Today, we are going to discuss about how the cancers spread to the spine and to the brain and cause problems. As we all know, when a cancer grows advanced, it can spread through the bloodstream to different organs in the body. One of the common places is the spine. In the spine, the most of the blood supply comes to the vertebral bodies and also to the skull, and there's some blood supply to the brain and the nervous tissues in the spine also. So we commonly see the metastatic bone diseases around the vertebral bodies. Because of these metastatic bone deposits in the spine, sometimes it can cause pressure on the nerve tissues if it grows. Sometimes the bones can fracture or even bleed. When there's a fracture or bleed, the spine becomes unstable. When it is unstable, patients cannot maintain the posture. Sometimes they get very severe pain. And sometimes, because the pressure on the nerves, the muscles can get weak also. Supposing if it goes to the head, headache is the commonest symptom. And at the same time, it can affect the brain and cause fits and many other neurological problems. So we need to understand, if you are a cancer patient, if you develop any abnormal symptoms related to spine like pain, disability, angulation, the nerve weaknesses, muscle weaknesses, then it should be discussed with the cancer specialist you are consulting and do the appropriate tests so that any early invasion of vertebral bodies or the nervous tissues can be detected. Because if we know the problem is spreading early, we can treat early and successfully. If it is late presentation, it will be very difficult to completely resect and treat the spinal metastasis, especially in the critical areas like thoracic spine as well as cervical spine. Therefore, you have to be very careful when you go for your oncological follow-up or cancer specialist follow-up. You need to discuss all your symptoms with him, take enough time and get his advice for what to be done. Once it is confirmed that you have a spinal metastasis, you need to discuss it with the neurosurgeon, and we'll have to have a meeting with everybody and decide what exactly we should do to you. In the coming up programs, we'll be discussing each and every cancer and what kind of treatment that we can offer to these patients.